U.S. Senators Tina Smith, Democrat of Minnesota, and Lisa Murkowski, Republican of Alaska, introduced two bills Thursday to direct $200 million federal funding toward mental health and addiction treatment during the COVID-19 pandemic. The percentage of adults reporting symptoms of anxiety and depression has more than tripled from 11% in 2019 to 37.7% in October 2020, according to a survey from the Kaiser Family Foundation. The number of overdose deaths has also accelerated since the start of the pandemic, according to preliminary data by the Federal Centers for Disease Control and Prevention. During this deeply challenging time, we must ensure people get the health care they need, Smith said in the statement. The Stopping the Mental Health Problems Act would provide states and tribes with $150 million to support community-based behavioral health services such as suicide prevention, crisis intervention, and outreach to underserved communities. The Emergency Support for Substance Use Disorders Act would give states and tribes $50 million to support recovery programs and fund harm reduction services like overdose prevention. The bills would prioritize culturally specific programs that serve populations which have been hardest hit by COVID-19, such as Black, Native, and Latino communities. It is clear we must continue to bolster the nation's mental health system to address existing behavioral health and substance abuse concerns that have only been exacerbated by COVID, Murkowski said in the statement. So, one of the things I like about the news, but less so about cable news, is that if you just sit there and read things, you actually do occasionally find out something you didn't know about. I didn't know that let me go back to it, number of adults reporting symptoms of anxiety and depression had tripled in the last 2 years. And that's something I haven't seen any of these different news stations talk about. That's a running theme of how news that's online so often is more valuable than cable news because there's these stories that occur that aren't discussed often. But uh, it makes complete sense because we've talked about how a lot of people aren't used to, because I've mentioned I'm kind of a person who doesn't really talk to that many people in person, so COVID hasn't really disrupted any, I guess, social thing I like to do, except maybe going to the theater every 3 or 4 months. But it completely, I'm convinced, is something that should be taken into account, referring to the mental health factor of COVID, because a lot of people have been put in a circumstance that is so antithetical to how they've lived up until this point. Um, and I never really was a big fan of Tina Smith. She was just always kind of a lame replacement for Al Franken to me. But policy wise, I can't really think of anything I'd criticize her over. I mainly was attracted to this story because I'm trying to cover Murkowski more for the reasons that I gave. And it would be really cool if people mentioned that they were trying to prioritize responding to minority communities, because oftentimes, the Republicans are said to only care about white people. So this is a story that is antithetical to that, and something that Murkowski, I mean, she should in general just campaign on trying to do things to address COVID. But I think if her campaign was run by people who were smart, they would use this as a means to talk about the things she has done in the Senate, especially with regard to this issue that's affecting everybody in the U.S. and across the world.